welcome to class 8 of the Integumentary System. In this video, we will learn about excision of the malignant lesion. If you haven't watched the excision of the benign lesion, you can watch that. It will be easy to learn excision of benign lesions also. So we will start now excision of malignant lesion. Okay, so excision of malignant lesion. So it is actually a complete removal of the cancerous skin. So malignant means it is a cancerous, okay? Okay, cancerous skin lesion including the full thickness of the skin through the dermis. Okay, you need to remember this. Okay, what is malignant lesion? It is a complete removal of the cancerous skin lesion. Okay, so that is the thing. Next, what does it include? It includes the local anesthesia. Okay, it will include the local anesthesia and the removal of the lesion, and simple closure of the wound is also included. Okay, so that is the thing. Already we discussed how we will code the lesion excision. Okay, how we will code the lesion excision if it is removed. So CPT will be depend on the how the lesion is removed. Okay, it will depend on the how lesion is removed, not the final pathology report. So CPT is based on the procedure performed by the physician. Okay, it will be based on the procedure that is performed by the physician. Okay, next we have excision. What is excision? It is a full thickness removal of the lesion through the dermis. So the full thickness removal of the lesion through the dermis is called excision. Okay, so removal of the lesion, some surrounding normal tissue margin. So along with the lesion, the physician is removing some healthy margin of the tissue. So you can consider it as the excision. So simple non-layered closure is included. Okay. So when layered closure is done, so when the layer, sometimes the wound is deeper. So whenever the wound is deeper and requires the layered closure, the physician will do deep dermal layer suturing and subcutaneous tissue closure and facial layer closure. Okay, that is the layered repair. Okay, so what is the important coding concept you need to know is if the lesion is uncertain, whether it is benign or malignant. Okay, you have to code based on how the physician has excised the lesion. Okay, you will not code based on the pathology report. When you will not follow the pathology report when the lesion is uncertain. Okay, if the lesion is not uncertain, benign or malignant, then you will code based on the how the physician excised the lesion. Okay, so these are the things. Next, if it is a low suspicion lesion, then if the doctor removes the lesion with a minimal margin like a benign lesion, you will code benign CPT codes. That is within the range 114 series. Okay. If it is high suspicious lesion, moderate to wide margins like a malignant lesion, then you will code CPTs related to malignant. Okay. So these are the things you need to worry in live coding. Okay, for just for a class, we need to know what is benign, what is malignant. So you will be getting to know all these terms and everything while doing live coding. Okay. So for minimal margin removal, you will code 114 benign CPTs. Moderate and wide removal, you will code malignant. Okay, that is the thing we have to know. Then we have golden rule for interviews. Then mostly they will ask that how you code based on the method of excision, not on the pathology report. Okay. So we will learn now what are the excision of malignant lesions. 116002 111606 we will learn in the form of a flow chart. Okay. So here the patient presents with the malignant lesion. Okay. He will present with the malignant lesion. So what the physician is doing, he will inject the local anesthesia and he will remove the full thickness incision through the dermis. Okay, through the dermis he will make an incision and he will remove the lesion is removed along with the tissue margins. Okay, along with the tissue margins he will remove the lesion. So again then he will repair the wound. How he will repair? Either he will do simple closure or the layered closure. Okay, so you will not code the simple closure. Okay, simple closure you not code, it is included, whereas complex repair you can code it separately along with the malignant CPT code. That you need to remember. So how you will be coding the malignant lesion excision? You will code based on the lesion size and the margins you have to combine together. So if lesion is 2 centimeters and the margins, he will say 1 centimeter margin. So 1 centimeter plus 1 centimeter you will add for 2 sides, right? So that is the thing. For let's solution 2 centimeters plus margins 2 centimeters, 4 centimeters, then you will go a CPT for the excision of 4 centimeters. Okay, for 4 centimeters you will code 11604 for malignant. Okay, so we have CPT code selection based on the lesion size excised. Okay, so 0.5 centimeter to or less if they are doing, you will code 11600. 0.1 to 1 centimeter 11601. 1.122 you will code 11602. 2.123 you will code 11603. 3.124 you will code 11604. More than 4 centimeter you will code 11606. So 601 to 6016 you will code. For what anatomical location? You will code for the excision of malignant lesions. So you will code for the trunk, arms and legs. Okay, you will code the CPTs for the trunk, arms and legs. Okay, that is the thing you need to remember while coding excision of the malignant lesion. So for interview purpose, they will ask total excised diameter is equals to lesion size along with the both the margins you need to code. For example, if the lesion is 1 centimeter and the margins are 0.5 plus 0.5, total excised diameter is 2 centimeters and you will report the correct CPT will be 11602. Okay, for 2 centimeters, you will code 11602. Okay. Next, we will go with the excision of malignant lesions for the scalp, neck, hands, feet, and genitalia. We have different set of CPTs. Okay. So 11620 to 11626. Same procedure, full thickness incision through the dermis, and he will remove the lesion along with the normal tissue margin, and he will repair it with the simple closure or a complex or layered closure. Complex or layer closure, you need to report it separately. Okay, so you have to measure total excised diameter, same thing. We have different set of CPT codes for the malignant lesions also. These are the different set of CPT codes. Okay, these are the different set of CPT codes for the malignant lesions. Okay, so what are the important points you need to remember? So each lesion is coded separately. Okay, you have to code for each lesion and total excised diameter, that is lesion size along with the margins. Simple closure is included. Okay, simple closure is included, and you have to report complex repair and layered closure separately. Okay, now we have excision of malignant lesions for face, eyes, lids, nose, and lips. Okay. Next, local anesthesia is given. Same thing. We have to report complex and layered repair separately. Same thing, and we have different set of CPT codes. Okay. These are the things you need to remember. So same thing. Each lesion you need to code. So these are same. Okay. So these are the things you need to know while coding the excision of malignant lesions. Please do watch excision of benign lesions and then come to the excision of malignant lesion. So because in excision of benign lesions, I have discussed each and every point very carefully. So you can go through all the guidelines related to it. Okay. Thank you. Subscribe for the latest surgery videos. For SDC training, contact SDC medical coding at gmail.com. Thank you.